So here's Paula. It's one of my patients who came to see me because she's been in pain for 2 years. And you see the premolar at position number 12 was root canal treated. Throughout the 2 years, CT scans were taken, radiology reports saying that tooth number 12 cannot be determined whether or not it's fractured. There's no visible sign of bone loss around this particular tooth. So she was given an appliance to wear overnight in order to avoid her touching that tooth. However, the pain continued. She was on gabapentin, but without really knowing whether or not the pain comes from this tooth. So when I met her, I suggested to her to remove this root canal treated tooth. And within a couple days after the removal, her pain completely went away. So the message of the story here is definitely that root canal treated teeth, even though on the x-ray they may seem fine, even on the CT scan, is that they can have microfractures that can cause head and neck pain. So after extracting tooth number 12, of course, she wanted a ceramics option, and the reason being her integrative physician actually requested that for her since she had an autoimmune issue. And here's tooth number 12. You could see that it's got a post on the palatal root, and I was suspecting that's where the fracture was. I want to walk you through this video of her treatment. Essentially, for those of you that don't have experience with ceramic dental implants are just as easily placed as titanium dental implants. I'm using a 2mm twist drill here, and I have decided to actually do her procedure flapless. The reason being, I like to preserve as much as possible the buccal and interproximal tissue profiles. And in her case here, I'm enlarging the osteotomy just like I would placing a titanium dental implant. And her bone, after 8 weeks post-extraction, as you can imagine, was still in the type 4. We don't have yet the mineralization. But at 8 weeks, we still have a lot of growth factors present in the site to allow for osseointegration. And I'm placing here her, this is a Xeramex body ceramic dental implant, and it's a transgingival implant. I'm getting a good torque, essentially at 45 Newton centimeters. And because of that, I actually have decided to go ahead and do her temporary. Also, we have a good ISQ value on this implant. It's anything over 65 ISQ reading. It's okay to go ahead and proceed with immediate temporization. And also, even though I'm using a peak temporary abutment, I'm still connecting it to the neighboring teeth, just to make sure, because since this is in a masticatory area, I want to make sure that I protect this implant in spite of the patient's eating habits, because we all know, even though we tell patients to be careful with what they're eating, essentially they consider even like sometimes crusty breads as being soft. So here we have her implant with an ISQ reading of 75, and therefore we can go ahead and immediately temporize this implant. And in my hands, using the Xeramex implant system, I can predictably engage it at an ISQ of 75, whether it is in the maxilla or the mandible.